it's assumed that a post-menopausal woman like myself must increase her levels of calcium to prevent bone loss. But in fact, only 40% of women actually require higher levels of calcium through supplementation because we eat a lot of calcium. The other 60% don't need it, but will take calcium supplements because they think they need to. But they take the calcium supplements that are not bioavailable, and they're poorly absorbed by the body.
Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is episode 132, Arthritis, Osteo, and Rheumatoid.
Yeah, we hope you enjoyed our last podcast where we introduced our incredible Forbidden VIP membership. But if you missed it, take a few minutes to listen to the shorter version at forbiddendoctor.com/VIP. We made a shorter version. We think you'll like it, and you can send it off to your friends and get through it quicker.
So arthritis is not an aging disease, even though older people are more prone to the osteo version. Well, you've been sold a bill of goods being told you should get arthritis when you get old.
Right.
This is nonsense. There are far too many people over the age of 70 who have no trace of arthritis. And we have seen many people in our clinic that first presented with arthritic pain, but no longer have any pain without the use of drugs.
Yeah, one lady who couldn't even walk across the room very well because of arthritic pain. Do you remember, it was either last Christmas
I remember.
Or two Christmases, I can't remember. But she couldn't visit her children in two different states because she couldn't travel at all. And last year, or it was the year before, she visited them. In fact, she had to get on two different planes and go two different places. It was incredible. But it was after 1 month of following the program we gave her. Older people are more susceptible because they've endured malnutrition longer and the joints have suffered as a result.
Oh, malnutrition, you say?
Yeah.
Well, yes, the standard American diet, we way overcook our meat. And as a result, very important amino acids that are needed for bone repair are destroyed when we cook the meat.
Yeah, this is going to be fun talking about this because arthritis is something that can be taken care of in the kitchen.
And we will also address rheumatoid arthritis, but that's a horse of a different color.
Yeah, that's autoimmune.
But it can still be helped with a few dietary changes.
We've seen a lot of good changes in our clinic with that. So here we are again. First, do no harm. We use this famous set of words because we feel all healthcare professionals proposing to heal should be guided or at least return to being guided by its meaning.
Yeah, Hippocrates actually was not the one who coined this phrase. He said something similar, but not like this. These words were actually coined in the latter half of the last century.
Yeah, and then squished down to a soundbite, which I love it. It's great. So
this podcast is being brought to you by the Forbidden Doctor's VIP membership, where you will enjoy, among other things, a 20% discount on all supplement purchases all the time, 24/7.
Yeah, and lots of other things. Just go to forbiddendoctor.com VIP, listen to a shorter presentation, explains it all, the incredible and amazing benefits of the VIP membership. Now let's jump right into this website. Podcast is not intended to be a diversion away from the current system of disease management. It is our intention to offer a rational and very effective approach to aiding your body in its ability to rebuild and heal. Please be advised that any suggested nutritional advice or dietary advice is not intended as a primary treatment or a therapy for any disease or particular bodily symptom. Nutritional counseling, supplement vitamin recommendations, nutritional advice, and the adjunctive schedule of nutrition is provided solely to upgrade the quality of foods in the patient's diet in order to supply good nutrition supporting the physiological and biomechanical processes of the human body.
Yes, let's get into it. Now, osteoarthritis, or just plain arthritis, is the most common kind of joint pain and discomfort. It's usually referred to as the wear and tear type. It's generally associated with aging, as we said before, because the malnutrition has gone on for so long. And it's found to cause discomfort primarily in the weight-bearing joints of the body.
That would be like the lower spine, the hips, the knees, although as this condition advances, other joints, as this lady shows, can be involved, especially the wrists and the fingers.
Yeah, absolutely. And for this reason, obesity is frequently a much aggravating factor.
Because the weight bearing.
Exactly. And unlike rheumatoid arthritis, with this kind, people do not necessarily get sick, and the conditions just get more painful after weight-bearing activity, such as exercise.
Yeah, so this form of arthritis, osteo, is characterized by degenerative joint changes that cause pain, tenderness, limited range of motion, crepitus, this really scary sounding word, and inflammation. Crepitus is a grating sound or sensation produced by friction between bones and cartilage or the fractured parts of a bone.
Yeah, if you were to turn your head to the left and look over your left shoulder and slowly move your head over all the way to the right, if there's any pops, clicks, anything, the old Rice Krispie stuff, snap, crackle, pop, going on, that's what is known as crepitus. And it can be in other joints, not just the
And Dr. McBride also says that it's toxicity building up in the joints, and it moves around, and eventually you, of course, don't clean up your diet, and so it stays there, and you
get to that.
You get pronounced with arthritis. So,
all right, so let's talk about the symptoms. Just generally, morning stiffness or stiffness after inactivity for less than 15 minutes. Joint pain is worsened by movement. It's improved with rest unless you've got a severe case. The soft tissue around the point of pain will swell. It'll get red and warm. The bony crepitus Mary just talked about. Deformation in the distal finger joints, which is the last tips of the fingers.
Crackling Rice Krispie noise.
Yes, and limited range of motion.
Yeah, and there are several more symptoms associated with osteoarthritis, but these are the more common ones.
Now, here's an interesting slide, calcium, phosphorus, and arthritis.
Yeah, and a word that's sometimes associated with arthritis is calcium. What we have seen in most of the vitamin, minerals, and trace minerals, as well as most of the endocrine glands, when arthritis is present, it's been shown to be related to a disturbance in calcium metabolism.
Yeah, it's the way your body assimilates and uses calcium is the problem. Now, the diet, to avoid this, the diet should be rich in unprocessed whole grains, and I don't mean bread, and fresh, lightly cooked or raw fish.
Sushi.
Ah, yes, think sushi.
Yeah, think sushi, and, they got the white rice around it, which isn't so good, but you can have a little bit.
But the raw fish has all of the amino acids that you need. And fresh foods like leafy green vegetables and steamed cruciferous vegetables.
Yeah, to break open that tough cellulose outer shell fiber of like broccoli, it needs to be steamed. You have to do that.
And this should supply a normal balance of what is known as acid ash or alkaline ash minerals. And if you're not going to eat this stuff that we're talking about here, you need to take phosphate liquid for to reinforce the acid side, or organically bound minerals to supply the alkaline side.
Okay, Jack, can you explain this acid and alkaline ash?
Yes, a lot of people listening right now are very familiar with that, but some aren't. Now, when you have a campfire, and through the heat of oxidation that's going on through the fire, that wood that you put in there, eventually the next morning, you have nothing but a bunch of gray ash laying around. When we eat food, the same basic process is taking place, only on a much slower rate because we're not burning up with a hot fire. But a fire is taking place nonetheless as energy is released from the food.
Yes, that is called the biggest disassembly line in the world, your digestion. And it reduces down at the very end to an ash.
Right. Now, that ash could be alkaline, and your body has to buffer that alkalinity to bring it to the proper pH. Or the ash, depending on the food you're eating, could result in an acid ash, and that has to be buffered up to the proper pH level. And when you're eating the kind of balanced diet we're talking about, the acid ash and the alkaline ash remainder balance one another.
Yeah, or eat what you crave. Your body will figure this out. But if you're not able to do it, or if you know you're eating way too much sugar and all the things probably you shouldn't eat because you are out of balance, then take the phosphate liquid and the organically bound minerals, because they will help normalize the pH in your body.
Now, the only way to specifically diagnose arthritis is with an X-ray, because it will show the spurs, something we refer to as exostosis, in the joints, in the skeleton. And when you combine that with stiffness in the joints, where they do not have the full range of motion, these things should be taking place without eliciting pain. But when there's pain in the joint and the joint on X-ray shows exostosis, in other words, calcium deposits, that is a good diagnostic tool. And a common complaint of sore muscles following a period of low activity, such as early spring yard and garden recovery from the winter, or starting some workout in the gym following a period of sedentary lifestyle, can bring on muscle aches and pains, but that's not necessarily arthritis.
Yeah, so while there may be some microscopic muscle injury present if you're doing the workout or working in the garden, that pain or stiffness that you think might be arthritis might only be muscle soreness brought on by a low tissue calcium level. So you might feel that you have arthritis, but in reality, you're experiencing just tissue calcium starvation.
Right. Now, it could also be pain brought on by higher levels of potassium in the muscle tissue following muscle fatigue. There's something called the sodium-potassium pump. And anytime you do a lot of heavy workout, you could end up with an out-of-balance mineral presence. And too much potassium in muscle tissue can cause fatigue. And that is not arthritis.
Yeah, it's assumed that a post-menopausal woman like myself must increase her levels of calcium to prevent bone loss. But in fact, only 40% of women actually require higher levels of calcium through supplementation because we eat a lot of calcium. The other 60% don't need it, but will take calcium supplements because they think they need to. But they take the calcium supplements that are not bioavailable and they're poorly absorbed by the body. Like, well, I don't want to mention product names, but they usually contain calcium carbonate, and they're very hard to absorb. So that extra calcium in their bodies has to go somewhere. It can end up usually as a kidney stone or arthritis and can lead to a magnesium imbalance also.
And magnesium and calcium come together in a particular package as well. And optimum magnesium to calcium levels are very important to maintain normal nerve transmission, neuromuscular activity, and the cellular function throughout the whole body. Calcium and phosphorus are opposites in the body, and they have to be in proper balance too, of about 3 parts phosphorus to 10 parts calcium, or calcium will precipitate out of the blood and it will start depositing in mineral form in the joints as arthritis. Now, Calcifood from Standard Process is the perfect blend of the phosphorus to calcium balance that we need, because too little phosphorus can be detected in the body with an increase in arthritis or tartar on the teeth or the presence of kidney stones. That can all be rectified by Phosfood liquid, for a great source of this mineral to keep in balance with calcium.
Yeah. And I can also tell if I need Phosfood liquid by the tartar on my teeth.
Yeah.
So truly, you know, if I noticed, don't tell anybody this, but I noticed after Halloween, I had more tartar on my teeth.
Yeah.
So I went and grabbed literally my bottle of Phosfood liquid because I knew that would help balance out that pH in my body.
It would bring the phosphorus back up that the sugar washed out.
Right. I brushed my teeth. And then I took the last of the Phosfood liquid I had. And by the way, that does go bad. So you need to use up the bottle. And mine was getting just a little bit dark. But I took it and boom, the next day, nothing. It was beautiful. So, but here's the scary thing.
Now, here's the common drug therapies for arthritis. Aspirin, for inflammation and pain relief, analgesia. Acetaminophen to reduce pain, say at 4,000 milligrams a day. That is extremely dangerous for the liver. And then the NSAIDs, the nonsteroidal anti-inflammatory drugs like ibuprofen and naproxen to deal with the pain.
Yeah. But
well, these are common drug therapies.
Yeah.
But keep in mind that about 35% of peptic ulcers, the ulcers in your stomach over age 65, can be attributed to the continual use of NSAIDs.
Yeah, I didn't.
And it's also been observed that NSAIDs can cause an increase in arthritis because it inhibits the cartilage repair. But that statement's considered controversial.
Okay, and just a little pearl of knowledge. If you do have these peptic ulcers, start chewing chlorophyll.
Yes.
Okay,
one of the best things you can do. And then there's tramadol, which is a weak opioid. And then actually getting cortisone injections into the affected joint or around the joint. I mean, it should be noted that all oral corticosteroids, like oral opioids are contraindicated. They don't do the job like a real good cortisone injection.
Wow. And there's none of them foundationally heal the reason for the arthritis.
Now, quickly, here is what is suggested nutritionally to deal with it. You want to reduce inflammation-causing foods like the refined foods, especially the refined carbohydrates, sugar, all vegetable oils except olive and coconut.
Especially cooked vegetable
and the processed, overcooked meats. Now, what we've found that anything past medium rare, when it comes to beef or lamb, you're killing what are called heat labile amino acids. They're destroyed by heat that are necessary for cartilage regrowth. And then the omega-6 fatty acids that produce, get rid of the omega-6, which is the most common oils out there.
We eat too much of that.
You hear about the benefits of omega fatty acids, but you want the omega-3s.
Yeah, we need to supplement with the omega-3s.
And almost all oils out there or the predominant amount is omega-6s.
Yeah.
So you want to use omega-3s because they reduce inflammation, promoting the right kind of prostaglandin. It's a chemical messenger that has an awful lot to do to trigger pain or reduce pain. And that would include cold water fish, raw nuts, seeds, and supplements that have essential fatty acids in them, like tuna omega-3 from Standard Process.
Yeah, and whole food vitamin C, not ascorbic acid, to support the growth and integrity of the cartilage. Cataplex C is our choice. And I do want to mention, too, Protofood, because when you overcook your meat, you kill those heat labile amino acids, and Protofood will restore that, along with Cataplex C.
Yes.
Those two things will rebuild collagen in your body. So get rid of wrinkles, girls out there. So Cataplex C and Protofood, I love those two together because vitamin C is the loom that protein winds itself around to make good, strong collagenous fibers.
Very good. Very good.
You get to talk about whole food vitamin.
Well, whole food vitamin C or E, and we're not talking about tocopherol oils. Whenever you buy a vitamin E product out there in the marketplace, it's just tocopherol oil, which is just the antioxidant portion of the vitamin E molecule itself.
Yeah.
You need the whole one because it slows down cartilage breakdown and it promotes cartilage formation. And wheat germ oil pearls or Cataplex E from Standard Process are wonderfully supportive.
Oh, I forgot to bold Cataplex E.
No, that's all right.
Yeah,
and then there's whole food vitamin A, the retinol form. But sometimes you're going to get it in beta carotene as long as it comes from food, which is why we recommend Cataplex A. But along with that, zinc and selenium, which all three of those, A, zinc, and selenium, protect the cartilage and reduce inflammation. And if you took a combination of Cataplex A and ageless thyroid, that would cover all of those.
Yeah, and you'd also get your endocrine system supported because ageless thyroid has the zinc and the selenium in it. And vitamin E has some too. So vitamin E...
arthritis does two things. It drops minerals in the joint space that shouldn't be there, and then it slowly destroys the cartilage surface, which is what vitamin E will help to alleviate.
Yeah, and so you can rebuild that.
And
remember, you can always rebuild this.
Yes, and then some more. Boron, one of the trace minerals, about 3 milligrams a day helps to slow joint degeneration.
Yeah, I just read a study, if you take 10 milligrams a day of that, you can raise your testosterone by 28 points or something.
Well,
or 28%.
I don't know anybody that needs to raise it.
Raisins are a good source. It's actually the best source. Avocados and a few others were good too.
And then glucosamine sulfate. Everybody knows that somebody's taking glucosamine for their knee joints because it promotes cartilage synthesis, which is the growth of cartilage, and the repair of the damaged joints. The overall effect is one of increased joint integrity and significant pain relief. Glucosamine sulfate has, in at least some studies, been shown to be more effective than ibuprofen at relieving pain, as well as being more tolerated than ibuprofen or other NSAIDs.
Way.
Yes.
Way more tolerated. It doesn't destroy your liver. How about that? So we recommend glucosamine synergy for lubricating the joints and the growth and repair of cartilage. And in some studies, it's more... Oh, you already said that.
Yes, it's more effective for pain reduction.
I'm sorry, it's on the wrong bullet.
No, that's all right.
Okay, the Forbidden Doctor supporting protocol for osteoarthritis symptoms.
Yeah, we've thrown a lot of stuff out at you, and it may well be that it's a bit confusing. So we want to just simplify it down to these 5 things.
Yeah, beta-col. This is a huge one. I had a guy come into our office that was horribly deformed, his fingers, from the osteoarthritis, and his whole family was, and they owned a business, and he was the only one that could still work. And we put him on this beta-col. I mean, a few other things too. I don't remember now, but the beta-col took away his pain. And he is the only one in the family that can work now because it's an incredible thing.
Then the glucosamine synergy that we just talked about, there's the dosages for the organically bound minerals, because a lot of times there's a few minerals concentrated in this that the body needs. Boswellia, some of you may have heard of that, for arthritic pain and maintains and supports healthy joints and healthy circulation. And black currant seed oil, of course, that reduces morning stiffness, but it needs to be taken in conjunction with the Boswellia complex. Now, Mary started off talking about beta-col, and I think we need to say more about that.
Well, before we go on, the black currant seed is very easily assimilated.
Yes.
Your liver doesn't have to convert it.
It's one step away from arachidonic acid in the liver.
And we're going to talk about Boswellia with rheumatoid arthritis too for pain, but let's talk about beta-col, because this guy came into me and he said, can I take more than 3 a day?
Usually you don't need to.
No, and I told him, no, that's all you need.
Well, because it's a detoxifying agent for the liver.
Yeah.
And it's designed to do that very thing, especially a sluggish liver that we see in arthritis. Because in some arthritics, the toxicity spreads to the bowel as well.
Yeah.
And the main function of the liver is to detoxify the bowel in its purest expression. And constipation seems to be an inherent problem with arthritis. And one of the most alkaline substances ever found in the human body is something called guanidine. And it's produced in the bowel because of bowel toxicity, because of the products in the bowel. The contents are not moving through like they should be with constipation. Yeah. And so this buildup of toxicity in the bowel puts a tremendous load on the liver, particularly in a patient with arthritis. And because of the high alkalinity of the guanidine, which leaks into the circulation, it can cause calcium to precipitate in the joints. Calcium, or at that point it will cause, or it can aggravate the arthritic condition.
Yeah, so beta-col is primarily used for liver detoxification. It has other benefits as well. It contains the Wolzen factor.
Yes.
It's so-called anti-stiffness factor.
Yes, it's something called stigmasterol. Your body makes this, but in beta-col there's a heavy doses of it. And it's named after Dr. Wolzen at the University in California that discovered this thing. I think it was back in the 1950s, if I remember.
Yeah.
And it increases the flexibility of arthritic joints.
Yeah, so there's 2 basic types of toxic liver people. Both will be bettered by improving bowel function and balancing their microbiota.
Yes.
Their microbiome. The first type has slow-moving bile and gallbladder functions. They've been eating a lot of fried foods with horrible oils, and it gives them a lot of trouble, and it manifests as gallbladder pain along with constipation. And this type would benefit from soybean lecithin and AF beta food.
And the second type is the arthritic type, second arthritic type with a bloated liver.
Ew.
And that's what responds to beta-col. Beta-col must be used with caution initially because it can put a greater load on the body's detoxification systems than they're used to. Sometimes just half a capsule is all they can tolerate at the beginning of the process.
Okay, so let's move on to rheumatoid arthritis.
Yeah, now rheumatoid arthritis, this kind of arthritic joint destruction, as I mentioned at the very beginning, is definitely a horse of a different color. It does not affect the joints the same way as osteo, and it does not wait until you are older to get it.
Yeah, and like so many diseases where the immune system turns on its own body, this one attacks the joints with your own immune system.
Yes.
And as recently as 1950, medicine did not even believe the body would attack itself. Now there are over 88 recognized autoimmune diseases. And on a side note, Dr. Royal Lee, the founder of Standard Process and the person we named our Lee enzymes after, was teaching a decade earlier about autoimmune dysfunction. So
there's a point where the body has a well-functioning and responsive immune system, and then it goes haywire.
Yeah.
And on this topic of rheumatoid arthritis, we will also touch on autoimmune disease a little bit and the role of protomorphogens.
Yeah, and here's the ostrophin PMG protomorphogen. And they stop the autoantibodies from attacking the joints in rheumatoid arthritis. And Rheumaplex is a supplement specifically designed to support the body when rheumatoid autoantibodies are present. It contains the protomorphogen, on the left, Ostrophin PMG for the joints. And it's a plex, so it's got a whole bunch of, it's a complex. It's got a bunch of stuff to feed your joints.
Yeah, we have many, many patients who have found considerable relief with this whole food supplement, Rheumaplex. And it is a plex, as Mary said, because there's a bunch of stuff
in it. It's a really wonderful product.
Yep.
So here's the symptoms of rheumatoid arthritis.
Yeah, it's a chronic inflammatory autoimmune disease. The main characteristics include symmetrical synovitis. Now, you remember synovial fluid, 8th grade biology about the body, where each joint in the body is surrounded by a capsule that contains the synovial fluid. And the part of your body that's immediately in contact with the synovial fluid is called the synovium. And synovitis is an inflammation of that.
Itis means inflammation.
Yes, and then also, of course, we have joint erosion taking place, and there can be manifestations of rheumatoid outside the joint, in the lungs, the eyes, the heart, and blood vessels.
Nasty disease.
And for some reason, it picks on women. A 3-to-1 ratio. Only 1% of our population suffers from this, but it seems to hit women 3-to-1 over men. And the usual onset lies between 30 and 60 years old, but the disease can strike at any age.
Well, I'm 56, so I got 4 more years.
Yeah. And symptom severity and disease progression vary widely among and between individuals. Onset can be rapid or it can be insidious. Insidious just meaning like, where did that come from?
Yeah. Here's some more.
Yeah. Malaise, low-grade fevers, weight loss, stiffness in and about the joints that follow activity, morning stiffness that lasts more than an hour. Remember I said osteo, in 15 minutes it should be gone. This goes on and on.
Yeah.
And then arthritis that shows up in more than 3 joints, specifically the finger, wrist, elbow, knee, ankle, and joints where the metatarsals meet the toes. The metatarsals are the long bones in your feet where they come down and attach to the toe.
I have super long toes.
Yes, you do. You have a super long foot.
Yeah, but I don't have any arthritis.
And symptoms outside the joints, you'll get these little rheumatoid nodules, which are little bumpy things underneath the skin. Pleural effusion, which is liquid collection in the lungs, pericarditis, inflammation of around the heart and the pericardium, lymphadenopathy, which means the lymph glands can swell and become a problem, splenomegaly, which is an increase in the size of the spleen because the that's immune central in your body, the spleen.
It's your biggest lymph.
And it will swell up big time when there's a big autoimmune thing taking place. And then leukopenia involving the white blood cells, vasculitis involving the vascular system, and normochromic or normocytic anemia, and elevated ESR, which is erythrocyte sedimentation rate. Erythrocyte sedimentation rate is something that's done when blood is taken and it's put into a test tube and it just sits there for a while to watch the sedimentation rate take place, because when you have a high level of inflammation, the red blood cells are being destroyed.
Boy.
And so you want a very low number for the ESR.
Medical researchers suspect, and this is what they say, is that environmental factors may trigger RA, and these include bacterial or viral infections and hormonal status.
Yes.
And I'm sure it's aggravated by that. And they say there may be other factors that disrupt the immune system. And so they say there's suspicions that include vaccination reactions.
Yes, there is indications.
And we would wholeheartedly agree with that because of our podcast we did on the vaccinations that shows how it turns your own body against itself.
And in people who work around any occupational oils, hydraulic, motor oils, petroleum distillates, and then you've got cosmetologists because of all the stuff they're breathing they shouldn't be breathing. And then people who are exposed to landscaping sprays and chemicals like professional golfers.
That's the number one most toxic profession in the world is a professional golfer.
And I'm taking care of a professional golfer right now, in fact, and I brought this to her attention. And she said, oh, yeah, we are aware of this. We know this. And then landscape workers, all of these seem to have a greater incidence of rheumatoid arthritis.
Yeah, and people with rheumatoid arthritis also need higher levels of tissue regeneration because it's degenerating. That includes the development of phospholipid protecting agents. Now, we have a product called Super EFF. It's for it's for super degeneration, literally.
Yeah, the phospholipid is just phosphorus and fats.
Yeah,
And
this
phosphorus, that's what your skin has.
Essential fatty acids.
Your skin is made of a phospholipid protecting or barrier. That's why you can soak in a bathtub and not fall apart like a soda cracker on top of a hot chicken soup bowl.
Yeah.
And there's always a breakdown of these kinds of tissues when you have a degenerative disease such as rheumatoid present. And so fat assimilation from a very good and proper source of fats, primarily the prostaglandin 3 producing fats, are always a must. Fats like butter, cream, coconut oil, macadamia nut oil, certainly not vegetable oils.
Especially cooked vegetable oils.
Especially cooked vegetable oils. These are very destructive of the tissues.
Stay away from, that's why you're supposed to stay away from fried foods, not because of the oil, or not because fried foods in and of themselves are bad. Actually, if they're cooked in lard or beef tallow, that
or
would
peanut
actually,
oil.
It would actually feed you. And the reason we say to stay away from fried foods is because they're always, always, always cooked in bad oils.
Yes.
So eat all the deep fried turkey you want at Thanksgiving this year if it's done in beef tallow or
peanut oil
or lard or peanut oil.
Absolutely.
So don't aggravate your arthritis anymore.
And we've done plenty of podcasts on the heart as to why lard is your friend, not your enemy.
So anyway, okay,
That's just a political thing to get people to buy vegetable oil.
So here's the medical drug therapies and treatments for rheumatoid arthritis.
And again, we're talking about NSAIDs, and the long-term use can give this gastrointestinal side effect that we talked about, the peptic ulcers, bleeding, and not healing the foundational problem and not healing the reason for the inflammation. And then you have the disease-modifying anti-rheumatoid drugs, the DMARDs, such as the gold salts, anti-malarials, and immunosuppressive drugs such as methotrexate. And we also know what methotrexate will do to the liver in time if it's there long enough. And then you got the corticosteroid drugs, the glucocorticoids, have both an anti-inflammatory and an immunosuppressive effect, such as prednisone. And of course, anybody who's been on prednisone knows what happens. It can lead to osteoporosis, mood changes, fluid retention, weight gain, and an elevated blood pressure.
Okay, I'm going to have to do my little screaming fit here because this drives me crazy. The new medical big fancy trend now is to get rid of inflammation. Inflammation causes everything. Inflammation is the killer. If we just get rid of inflammation, then everything would be fine. And they totally missed the whole point. This is what the Forbidden Doctor brings you. You need to get rid of the reason for the inflammation.
Yeah, because inflammation's a natural process the body uses to heal. But what happens when it goes on and on and on and on?
Yes, it is bringing blood to a part of the body that needs to heal. And how else can you heal but by your blood? So it brings this healing nutrition, hopefully that you've been eating enough nutrition or supplementing, that it can bring these healing fats and nutrition and minerals and vitamins and help heal the wounds in your body and help restore and rebuild the collagen and the bone and everything it knows how to do so well. It is not the inflammation that is the problem. Now, chronic inflammation, especially in the heart and other places, can be disastrous. I agree with that. The big elephant in the living room that they don't look at is healing or stopping the reason for the inflammation. Yes. I mean, force works. You can take these anti-inflammatories and man, you feel great. But did you heal anything?
And what's the side effect of that?
Oh, your liver damage.
Prednisone.
Yeah. Oh, I'm not even going to get into steroids because I have such a problem with them. But see, here's the thing. Force works. That's why it's so deceiving. I mean, you take these anti-inflammatories, bam, it works. And so you think, oh, I'll just take these forever, or I'll take prednisone forever, which of course you can't do. And that's it's so important to heal, and that's what the Forbidden Doctor is bringing you. It's like here's an example of force. Your little kid's running out in the street. Well, sure, you're going to use force. You're going to grab your kid and pull him back out of the street and save their life. And that's a wonderful thing, but it doesn't heal. You can't stand by your kid your entire life and stop him from running out in the street. You can't hire a bodyguard to stand there and make sure he doesn't run out in the street. You need to do something healing. And healing is sitting down with a little boy or little girl and saying, let me tell you how much I love you. Let me explain physics. Let me explain this 2-ton truck and your little 30 pounds and how you can't run faster. And let me explain the life you're going to have in the future. You're going to you'd miss out on flying airplanes. You would miss out on, scuba diving and seeing whales. You would miss out on so much if that big truck hit you. So you need to listen to your mom and heal this thought and fix the reason for and stop the reason for them running out in the street. And that is what food does. Food heals the reason for the inflammation. And you've been taught the wrong foods to eat. You've been taught to eat all vegetables and no fat and no meat. And above that, you need to eat what you crave. So this drives me crazy, these drugs that stop the inflammation, that stop all healing. And when you stop the drug, is your arthritis healed? No.
No, you find out you got to start taking the drug again.
And you're much worse usually. So it's very So this
is very beneficial, everybody. You just got a podcast inside of a podcast. And this is a hot topic with Mary.
This just drives me crazy.
And for some, this is the only thing they know how to do to deal with their symptoms. But there are other things people can do and often find better relief with these drugs can do that have none of the dire side effects.
Okay, so here's the medical approach for nutritional therapies for rheumatoid arthritis. Just get rid of the offending food. Just stop it. Just stop eating wheat and corn and dairy and just never eat cream the rest of your life. Never have ice cream the rest of your life. And then you go on this elimination diet to identify which foods constitute a problem. Well, every food will be a problem after a while if you don't heal your gut. And then the medical approach is to avoid these foods completely for 2 weeks, then reintroduce the foods one at a time every 3 days and note the symptoms. Is that crazy making or what? And then they say, you have to go off all citrus. You have to go off chocolate. Are you kidding me? You have to go off alcohol, processed meats. Well, that's a good one. You shouldn't have processed meats. Flour products. How can you avoid that the rest of your life? Spices. Are you kidding me? Spices are the spice of life. You have to eat spices with meat. It brings out all the nutrition in meat.
Yes.
And carbonated drinks. Okay, sure. Get rid of those. And because they may aggravate RA.
And Mary mentioned healing the gut here a moment ago. That's the real foundational problem here. Not just calcium and phosphorus assimilation that we talked about earlier. It also has to do with toxins leaking through a leaky gut, and everybody has a leaky gut to some degree or another if you haven't fixed it. And those toxins get through the gut, they get into the bloodstream, the body finds places to deposit
Loves the joints. Loves
the joints.
Yeah. And so, you might have to put up with a little bit of pain, a little bit of inflammation. And I know I am being sympathetic here. You put up with a lot of inflammation. So maybe you need some pain pills while you heal this foundationally. I am not against that. Sometimes you have to do those extreme measures just to make it through the day. But then let's go in and heal it foundationally. Let's heal the gut foundationally. Okay, big breath here. Let's go to the next slide. Okay.
All right. So
here's the standard nutritional approach. This is not ours, but this is the standard.
This is what most people out there are talking about.
Yeah.
A vegetarian diet high in bioflavonoids can provide some relief of
because
symptoms.
It cleanses out your liver. Yeah. I agree. It does.
Then this diet would have plenty of green tea and blueberry and elderberry and low amounts of vegetable oil.
Yay.
A small amount of people respond dramatically to a diet free of the nightshades.
Yeah.
Which is peppers. That's pepper and eggplant. The peppers.
We don't like those anyway.
Yeah,
so.
Eggplant, tomatoes, white potatoes,
like
and a month-long trial is recommended for this to be instilled in your dietary
And then they say
program.
to supplement with synthetic, all these things, synthetic selenium, because people with RA have low levels of selenium, and zinc. I agree with these.
Along with manganese, both of these have been shown to be very low in people with rheumatoid arthritis.
Yeah, but again, let's fix the...
But they're thinking meat is bad. That's why they don't talk about it. They tell you to get away from meat. It's not that meat is bad. It's the cooked meat, and it's the meat that has antibiotics and steroids and or whatever.
And they're fed the corn, the GMO corn-fed, Our meat is proudly
Pesticides, herbicides. That's what I'm trying
That's
to
what you're trying
think.
to come up with. Yeah, all those scary things. Okay, and here's some more recommendations.
Yeah,
by
they
them.
tell you to get omega-3 fatty
That's
acids.
good.
Because that suppresses the production of the inflammatory compounds, the wrong kind of prostaglandin that I was talking about. And then bromelain, which is just a proteolytic enzyme. And you take it away from food, it has an anti-inflammatory effect.
Yeah,
And that's why we've promoted our long life energy enzymes. I mean, it's a stronger form of what you're going to find here with bromelain.
Okay,
And you take it away from food because it helps to clean the joint.
now, when I have to put this in here, I have to, because you guys have to understand this. When you start taking the Lee enzymes, and I recommend you do it slowly, it will do a fantastic clean out of your joints, and it might be painful. You might wake up not really painful, just stiff. You wake up in the morning and you might feel stiff. That's okay. That is clean. Now, it shouldn't stay. It shouldn't be unless you have full-blown, osteo and rheumatoid.
Right.
But this will help prevent this from happening to you, and you might feel a little joint stiffness for a month or two as it slowly cleans it out. Now, if you're like me, who went on what did I do, 8 or 12 a day when we first got it?
Well, we did. We did it for almost a year, trying to overdose on these things.
Yeah.
I remember for a long period 24 a day to see if that would hurt me. It never did.
And I remember being a little bit stiff. I was surprised I had some toxicity in my joints. I remember getting up and feeling a little bit stiff. I was doing large doses of this too, but that only lasted for what do you think? Maybe a couple of months? I don't know. I don't remember.
It's too long
because it didn't last very long. I'd get up in the morning, I'd feel stiff, and then I was like, that's weird. This has never happened. And you can think that, oh, geez, this is bringing on arthritis. And it is not. It is like the inflammation. It is cleaning you out. And it's a very important thing to understand. And it's all gone now. I still take about 8 a day. I don't have any stiffness in the morning. The worst thing is that I wake up so incredibly awake in the morning. I want to sleep in like I used to be able to.
Yes.
I can't. I wake up. It's why we named it energy enzymes. I wake up at 5 or 6 in the morning and I'm just like, bam. And I'm like, I can sleep in today. But no,
you can't.
I can't.
Nope. You grab your computer and you get to work.
It's a wonderful, wonderful product, and that's why we named it after Dr. Royal Lee.
Also, a product called quercetin is recommended, and a good source of that. It's in ginkgo. It's in our standard process ginkgo, and it I think it's ginkgo forte.
Yeah,
I think it's
it is. It is,
and it
good for the
stabilizes
brain,
the
too.
mast cells. Now, mast cells are what release histamine, and histamine is the allergic reaction you get. And in a contained area inside the synovium of a joint capsule, it can definitely tend towards increased pain.
Well, I would
and
agree
we
with
find a lot of mast cells inside the synovial membrane of the affected joints.
Okay, let's wrap this up.
Yeah,
Here
we need
is the Forbidden Doctors Supporting Protocol. Yay! This is for rheumatoid arthritis. We mentioned at the beginning Rheumaplex, 9 a day. It helps provide healthy joint support. It also promotes healthy bone tissue and supports healthy connective tissue as well. And it supports the body's normal tissue repair process. We described it a little bit more in depth with the autoimmune attack and everything else. We won't do that again, but it is a wonderful product. Many people come in and buy that
They buy 3 and 4 bottles at a time.
at a time, yeah.
And then Beta-Col, we've talked about that for liver detox. And the Boswellia.
Start slowly on that Beta-Col too, so you don't detox real fast. Okay, and then Boswellia, go ahead.
Well, excuse me, for arthritic pain, and we talked about that with Osteo. It supports the healthy joints. It supports healthy circulation in the body.
Do you want to tell about your patient that started taking Boswellia?
Well, it usually when somebody starts taking Boswellia for pain, whether it's arthritic pain or some other kind, it usually within 3 or 4 days they begin to notice improvement. Well, I gave it to him, and he comes back in a week later. This stuff isn't working.
He was taking 3 a day.
Yeah, I said, Richard, I'll use the name Richard. It's not Richard. Richard, you need to do more. He's a big guy. He's a farmer. He raises bulls.
And his feet hurt, right?
And his feet are really hurting, and he's had a hard pounding life his whole life. And I said, I want you to start double the dose. Well, why would I double something that's not working? Richard, double the dose. And he comes back in a week later, and he says, I want my money back. I said, Richard, I'm not going to give you your money back. I told you up front, this takes a while for this to happen. I want you to go even higher. I want you taking 9 of these a day. 3, 3, and 3 throughout the day. I don't see him for 2 weeks. He comes back in, and he's sitting there in a chair with his little smirk on his face when I walk in the treatment room. And he jumps up out of his chair. And I said, well, you haven't stood up that fast for a while. My feet don't hurt. Well,
And-
what do you know about that, Richard?
Yeah.
What do you know about that?
And if he had our VIP membership, he would have got 20% off because that's got to be expensive.
Yeah,
9 of those a
Boswellia,
day.
Yeah, 9 of them a day. And I
Herbs
said,
are
don't.
expensive.
And his wife is there with him. And she said, no, he took it. He didn't miss a dose.
9 a day. Wow, that's fantastic. Okay, and then we talked about the blackcurrant seed oil. It reduces the morning stiffness.
Yep.
And take it in conjunction with the Boswellia complex.
Yeah, Boswellia needs fats for
Right.
for it to be absorbed properly, and the blackcurrant seed oil is an excellent healthy fat to do that.
Okay, glucosamine synergy for lubrication of the joints. Cataplex E, this is the selenium.
Yeah, we talked about that in the other one.
It inhibits cartilage breakdown and promotes cartilage formation.
Trace minerals B12 because a lot of people simply have missing minerals, especially low levels of zinc, and then there's low levels of copper, low levels of manganese are usually present with RA people.
And super EFF, I got a typo there, for tissue regeneration that includes the development of phospholipid protecting agents.
Yes.
Whoa, that's super important. That has been a miracle product for people.
many people, and also with people with MS, people with Parkinson's,
Any cancers,
nerve degeneration problems.
any really bad autoimmune diseases, or as Dr. Lee said, for people that are wasting away.
Yes.
It's a cellular food, and it goes in right into the cells, even if your cells are so old and tough and they're not soft and pliable and absorb, they don't release toxins and
Right.
absorb nutrition well. This super EFF will get in there. So there's many more, but these are the main ones I would take for rheumatoid. I know that's a lot, but rheumatoid is a big problem.
Yep.
So, and then a toxic liver promotes arthritis. A toxic liver, we decided we put these three ways that it can be addressed, and it's a simplified process. Go ahead.
Well, you have to acidify the liver to neutralize the alkalosis effect of the guanidine. In other words, the guanidine is a very alkaline substance, and we have to acidify the liver in order to do that. That's what this beta-col tends to do.
And 2, the liver must be detoxified.
Yeah, your liver has over 600 identified functions, but they break into 2 primary categories. Number 1, it's either digesting food, or number 2, it is purifying the blood. And when it becomes toxic itself, because of the overload of food or too much of the wrong kind of food, it has a very hard time detoxifying itself. That toxin will build up, eventually gets to the bowel. The bowel toxicity comes back to the liver, and so the liver has to be detoxified, which is what beta-col does.
Beta-col again. And bowel toxicity, well, you just talked
Yeah, I
about this
kinda just talked about
constipation.
that.
Must be cleared up.
Yeah.
Okay, and there's 2 types of toxic liver. One is a gallbladder issue, a bile issue.
Yeah, we mentioned this earlier in the podcast,
Yep.
but here's what we recommend.
And the bloated liver, of course, is beta-col. So you can add if you have gallbladder problems or have had them in the past, you can add in the soybean lecithin and the AF beta food.
Right.
Okay. And
So you don't have to be condemned
Yeah.
to a life of pain with arthritis.
this is such a beautiful picture. Look, he's grabbing her hand.
And she's letting him.
Yeah, it's not hurting.
He actually can grip, and she's not pulling her hand back screaming.
Yeah.
And the protocols that we are suggesting cannot hurt you.
Yeah.
And they because they're whole food concentrates.
Yeah.
And they may be the very thing you're looking for.
And remember, you might have to go through a little detoxing symptoms to get through this and to the other end, but they are incredible protocols. And to help you buy them,
Yeah, we know these protocols are expensive.
Yeah.
And you'll need personalized help to get through and implement these nutritional therapies in your life. So check out the Forbidden Doctor membership for many more money-saving benefits and interactive help.
and you know what, Jack?
What?
This podcast is coming out during our Black Friday sale.
Oh, gosh, it is, isn't it?
And we have decided to give our VIP membership, just the VIP membership, a 30% discount on all supplements through the sale.
Wait a minute.
Yeah, I know.
That's practically our cost.
Yeah, but it's only fair for our VIP members to get a deal too on Black Friday. We couldn't undercut them.
So if people sign up for the annual membership during this coming Black Friday sale, they can take advantage of the 30% off right away?
Yep, and that's what we decided. You remember, you and me, we decided
We talked
during
about
the
this?
4 days of the Black Friday sale.
Maybe we should do a short-term memory cure on our next podcast.
Well, that would be a podcast about you. So go to forbiddendoctor.com/VIP, listen to a shorter presentation that explains all the incredible and amazing benefits of the membership, and you will get, during our Black Friday sale, 30% off all supplements if you are a VIP.
For the annual members.
For the annual members.
All right. So the non-annual members, the monthly members,
That they will get it too.
they'll get if they
No, the monthly will too. Yeah.
during the sale.
During the sale.
Wow.
Yeah.
Wow.
So anyway, go to forbiddendoctor.com. Don't forget the .com/VIP and sign up for the manual or annual or monthly membership and get 30% off for 4 days.
Yes.
Yay. And we will see you on our podcasts the next time.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.